Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula County Health Department's COVID-19 response. Today is Thursday, January 21st, and this is our COVID briefing. We've now had 7,371 cumulative positive cases of COVID-19 in Missoula County to date, with 47 new cases since yesterday. We've had 60 deaths associated with COVID-19, and currently we have 8 Missoula County residents and 7 non-county residents hospitalized in Missoula County. We now have 3,008 active COVID-19 cases. Those active cases and their identified close contacts do remain in isolation and quarantine and are being supported as needed. Our current average incidence per 100,000 people is 37. And just a reminder, we really want to see that number get down to 25. All of these numbers, as well as the graphs and figures associated, are found on our website at missoulainfo.com. The state of Montana is reporting 90,649 cumulative COVID cases, which is up 408 new cases since yesterday. There are now 4,841 active cases with 137 active hospitalizations across the state, and there have been 1,100 deaths related to COVID-19 statewide. The University of Montana has had 533 cumulative associated cases since the beginning of fall semester, with 3 new cases reported since yesterday, and there are currently 17 active associated cases. First, I just want to talk for a moment about case investigation and contact tracing. When we saw our last spike in cases in October, we were having difficulty keeping up with case investigation and contact tracing. At that time, we moved to a new system called Sarah Alert. Sarah Alert is a web-based system that was specifically designed to assist health departments to do rapid case investigation and contact tracing specifically for COVID-19. Since changing over to that system and adding some additional staff, we are able to continue to complete case investigation within 24 hours of receiving notification of a new case. And in most cases, we're able to complete contact tracing within 36 hours. So we've definitely seen an improvement there. It is really important that you take a listen to your voicemail and answer your phone if you're getting phone calls from a 258 number, 880. We've got people that are using their cell phones, so definitely try and catch those calls so that we can get through that process quickly. Next, I want to talk about the COVID-19 vaccine. There is still limited vaccine availability in Montana and in Missoula County. While we have been able to get weekly shipments of the vaccine into our county, the amount of vaccine that we are able to receive is really dictated by the amount of vaccine allocated to the state as a whole. Right now, Montana is only able to receive 13,525 doses of vaccine per week to be distributed throughout the state. Missoula County, and this includes all providers in the county as a whole, is only able to receive a total of approximately 1,500 doses of vaccine per week. So while we know that everyone is anxious to get vaccinated, it's going to take some time for us to get the vaccine widely distributed due to the limited amount of vaccine that we're actually able to receive. And we do not know when our allocation may be increased, but we will keep you posted as we continue to move forward. At the health department, we are working to finalize a lease agreement with Southgate Mall to utilize the Old Lucky's market space for vaccinations. We hope to have that clinic up and running in the next week or week and a half. In the meantime, we continue working with our community partners to move into vaccinations for those who fit into the 1B category. As we move through these phases, I just want to remind you that if you were in a previous phase, like if you were a healthcare provider that was unable to get in during 1A, to get vaccinated, you'll still be able to get a vaccination appointment in that next phase. The current estimate for the number of people who fit into phase 1B in Missoula County is approximately 39,000 people. The Emergency Operations Center has stood up their Type 3 incident management team to help get the information out to the public about where and how to sign up for vaccination appointments. They will be posting that information at covid19.missoula.co. We will also have a link to that website on our website at missoulainfo.com. Last, I just want to remind everybody that we are still seeing the spread of COVID-19 in our communities. So if you are experiencing any symptoms, please call 258-INFO to schedule an appointment through our drive-through testing facility on Flynn Lane. And that's it for my daily briefing today. As always, you can subscribe to us on YouTube under my name, Cindy Farr. That's CindyFarr. Click that notification bell so that you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. You can check out MissoulaInfo.com for all of the most recent information about vaccinations at the health department, as well as basic vaccine information, frequently asked questions, and all of our data and our numbers that I just reported here are also found on that website. So check that out. And again, call 258-INFO if you have any questions or if you would like to schedule an appointment for a test through our drive-through clinic. And that is it for today. So until Tuesday, everybody, stay healthy.